Hello, my name is Amy Brandt and I am one of the friendly staff over at Olympic Community of Health. We are so excited that you are interested in joining an Olympic Action Collaborative. So I'm just going to give you a quick overview of what to expect from the Olympic Action Collaborative kickoff on March 30th. So you may be asking yourself, what is this? Which is a really good question. The Olympic Action Collaboratives are regional work groups working across Clallam, Jefferson, and Kitsap counties and the 7 sovereign tribal nations to collaboratively address regional priorities. Several years ago, OCH partners identified regional needs and priorities. We are now embarking on a new phase of work detailed in our 2022-2026 strategic plan to continue to foster this region of healthy people, thriving communities. In this plan, we've identified 4 focus areas. Together, recovery is possible. Everyone has access to the full spectrum of care. Individual needs are met timely, easily, and compassionately. And everyone housed. The focus areas reflect the prioritization of partners. While there are many focus areas that deserve to be acted upon, these 4 topics serve as a starting point to maximize collective impact, ultimately pushing us towards our vision of a healthier, more equitable 3-county region. We will be building upon progress and lessons learned to move forward in an even stronger and more impactful way. We want you to come and share your expertise and experience because we know that we are stronger together. So now you may be asking yourself, I'm already on a related work group. How is this different? These groups have a regional focus. They're looking at systems level change through collaborative action. The groups will develop specific measurement plans to guide their work, including identifying both long-term priorities and at least one Do It Now project, which builds momentum and energy, fostering early successes that will later inform the longer-term priorities. These groups will provide opportunities for regional networking, connection, and relationship building. We will also look at regional data, elevate community voices, and making sure that these groups are action-oriented and fun. These groups won't solve all the region's health issues, but rather provide a focused environment to maximize our impact. These groups also won't solely focus on the Medicaid beneficiary population, as each action collaborative will identify the populations to prioritize. And the work that we're embarking on is really hard, and our work most likely won't be accomplished in one meeting. So these groups will meet 6 to 7 times throughout 2022. At the end of the year, the groups will come together to share progress and plans moving forward. The focus areas are interconnected and highly dependent on a multidisciplinary and collaborative approach. So when you're thinking through the value add of joining this event and these meetings throughout the year, ultimately we believe these collaboratives will not only spark meaningful action, but will also complement and build upon you and your organization or tribe. Partners will build strong relationships with one another, creating space for shared resources, peer learning, and maximized strengths. These collaboratives also offer opportunities to learn more about your neighboring communities, what contributes to health inequities on a regional level, and elevating voices from different backgrounds and perspectives. By leveraging our collective expertise, experience, and wisdom, we can tackle these health issues that no single sector or tribe can tackle alone. This is a really exciting opportunity that we hope you're looking forward to as much as I am and the team over at OCH, but you don't have to take my word for it because our partners say it best.
One thing that I love most about OCH is the fact that it is putting those pieces together.
Yes.
Being in a room with Mike Maxwell, Dr. Maxwell, right? So at first I was very intimidated. They were speaking a language I didn't even know what they were talking about half of the time. And then over the years, they, I guess, just got used to me being there. and so I knew when to speak up, when it was appropriate. and now they seek what I have to say.
It's really important for agencies to look within their department. There's a wealth of knowledge between agencies. We all have different ideas. We all have different gifts to bring to the table. And so really start identifying where the holes are and start open communication between departments to find out what you can do for your community, and you'd really be surprised what you can find out.
But we know we can't do it alone, and we know that we have to work together in our community to help solve these issues for our patients and our community members. And that's where we see OCH filling such a need for our community, is to bring all of us together to help take care of our community members, not just on the individual patient level, but on the population level as well.
We've made so many improvements within our office just from the connections we've made with OCH and the benefits that we're providing to our patients. And I want to see that grow.
We are so excited to kick off these groups, and we really look forward to having you be a part of this important work. We'll see you there on March 30th.